और उस मेडिकल सीट को पाने के बाद आई हैड अ लॉट ऑफ टॉपर वाली वाइब एंड आई हैड ऑल ऑफ दिस ego in me and pride in me that I was somewhat of a topper. Your parents will tell you that after MBBS you're set. Then internship will come and they'll tell you after internship you'll become set. And then NEET PG exams will come and after that your PG will come. And don't wait to get set in MBBS because अब जब medical college पहुंचोगे तो आप realize करोगे कि the biggest knowledge you will get in medical college is not about any science or human body कि orthopedic surgeon कितना कमाता है. So let's answer that question now. हेलो एवरीवन, मेरा नाम डॉक्टर दैविक टी शेट्टी है और मैं आपको मेरी मेडिकल की जर्नी के बारे में बताने से पहले एक छोटा सा इंट्रोडक्शन देना चाहूँगा. आई एम एन ऑर्थोपेडिक सर्जन वर्किंग इन मैंगलोर, कर्नाटका. आई हैव रिसेंटली कंप्लीटेड माय स्पेशलाइजेशन इन स्पाइन सर्जरी. आई एम ऑल्सो अ नेशनल लेवल फैकल्टी फॉर नीट पीजी ऑर्थोपेडिक्स एट मणिपाल मेडेस. And I'm also the founder and the president of Fortune Academy of Health Sciences, which runs 2 nursing colleges in Karnataka. Now, whenever I've seen any esteemed doctor come on this podium and talk to you, all of you, I've noticed how they always talk about their gold medals, their ranks, and also about them being class toppers. मैं भी यहाँ खड़े होके वही कर सकता हूँ. मैं आपको बोल सकता हूँ कि मैंने अपने 10th स्टैंडर्ड में कैसे टॉप किया था और उसके बाद 12th में अच्छा रैंक पाया था और फिर नीट यूजी में भी अच्छा रैंक पाके आई एंडेड अप गेटिंग एन एमबीबीएस सीट एंड आई टॉप्ड एवरी ईयर ऑफ एमबीबीएस एंड देन एंडेड अप गेटिंग अ नीट पीजी सीट इन ऑर्थोपेडिक्स. मैं आपको ये सब बोल सकता हूँ और शायद ये बहुत इंस्पिरेशनल भी लगेगा सुनने के लिए, बट ये मेरी स्टोरी नहीं है, ये मेरी कहानी ही नहीं है. मैंने कभी भी एक गोल्ड मेडल नहीं जीता है, कभी भी क्लास में टॉप नहीं किया. इनफैक्ट आई वाज नेवर द स्मार्टेस्ट पर्सन इन एनी क्लासरूम दैट आई वाज इन. तो आज मैं आपको ऐसा क्या बता सकता हूं जो इतना इंस्पिरेशनल लगेगा. इसका आंसर देने से पहले I'd like to tell you all a small story, and this story is from my final year of MBBS when I was giving my medicine case presentation, and during this time I was given a case जिसके बारे में मुझे कुछ आइडिया ही नहीं था. I didn't know what case it was, what diagnosis it was. तब I remembered an advice from one of my seniors जो नॉर्थ इंडिया से था. उसने एक एडवाइस दिया था कि whenever you don't know anything about a patient, always give long लंबे आंसर्स देना ताकि एग्जामिनर तुम्हें पास कर दे. So I thought of following this advice and I followed it very diligently. I gave long irrelevant answers to every examiner's questions, and at the end of the exam, magically the examiner ended up failing me. And that was the bad part. Now listen to the good part. After failing me, he gave me an advice that has stuck with me even now as I follow my career, and that advice was that, Daivik, you're going to be a doctor very soon. And once you become a doctor and you're starting your clinical practice, you will see a lot of patients, and sometimes you will see some patients whose diagnosis or treatment you will have no idea about. And in such instances, when you cannot offer the patient the right diagnosis, when you cannot offer the patient the right treatment, at least offer the patient the truth. So आज मैं वही advice follow करने वाला हूँ, and instead of telling you an inspirational story about me, what I can tell you is my truth. मैं आपको मेरी सच्चाई बता सकता हूँ. I can tell you my ordinary journey into this extraordinary field of medicine. I've been practicing as a doctor now for the last 8 years, and I've seen that there are certain skills that every doctor or medical student needs to have in order to become successful or at least survive in this field of MBBS. So I'll share with you those attributes, those qualities, so that even you can nurture them as you follow your MBBS dream. The first attribute is that of having the right intent. सही इरादा होना चाहिए, और ये इरादा ऐसे आता है कि you have to ask yourself before giving your NEET UG exam, why I am becoming a doctor? मैं डॉक्टर क्यों बन रहा हूँ? अगर answer of this question is that because my parents want me to become doctors, or I'm doing this for the money, or because I'm a topper so it is natural that I have to become a doctor, then these are all the wrong reasons to become a doctor. And I'd ask you to reconsider your decision, because the decision of going into this journey of medical has to be your decision. It has to be your intent, because medicine एक ऐसा सफ़र है जिसमें आपको बहुत डिफ़िकल्टीज आएंगे, बहुत ऑब्स्टिकल्स आएंगे. तो अगर ये जर्नी में आने का डिसीजन आपका नहीं रहा, तो you will never be able to admire this long journey of medicine. Let me tell you my story about how I fell in love with medicine. And this story starts in 8th standard. Very young, but it starts at 8th standard. In 8th standard, I was this normal kid who used to go to school, come back, go to play, then sit back, do my homework, and I used to love this routine. मैं उन बच्चों में से नहीं था जो स्कूल जाने वक्त रोते थे. I used to love going to school and I loved this whole routine. But in 8th standard, I started limping. I started having this severe pain in my hip region, and I started limping every time I walked, and my parents got worried. They took me to the doctors, and I remember this day like it was yesterday. I remember going into the hospital, seeing all of these amazing doctors work, and it was love at first sight. Now that was the good part. The bad part was that they diagnosed me with a condition called as SCFE, slipped capital femoral epiphysis, जो एक pediatric hip deformity होता है, and because of that I had to undergo operation immediately, and I was told by my doctors कि मैं 1 साल तक चल नहीं पाऊंगा, that I will not be able to walk for 1 year. Now imagine a 13-year-old child who's been told that he cannot go to school, he cannot go to play, and he has to sit for more than 1 year. Can you imagine how depressed that kid will be? Well, it was a very depressing phase, but there was one silver lining. एक कहावत है ना इंग्लिश में that life is an equalizer. If it gives you some amount of sadness, it will balance it out with some amount of happiness. So in this whole period of 1.5 years, the one happy thing, one silver lining was that I got to witness this amazing profession of doctors firsthand. I got to see how much impact a doctor can have on a person or a patient, and that for me was the purpose of my life. सुनने में बहुत ड्रामेटिक लगता है कि एक 13-year-old चाइल्ड अपना पर्पस ऑफ लाइफ बोल रहा है, बट दैट वाज हाउ इट वाज. आई फेल्ट लाइक इट वाज द पर्पस ऑफ माय लाइफ. और अगर आपको याद है तो हर फंक्शंस में अंकल आंटीज तो पूछते थे कि बड़ा बेटा तुम्हें बड़ा बनने के बाद क्या बनना है. And I used to get irritated with this question every time, and every time I had a different answer. Sometimes I used to tell that I want to become an astronaut. Sometimes I used to tell I want to become a cricketer. But after that 8th standard phase, after that phase where I got to see doctors, whenever they asked me कि बेटा तुम्हें बड़ा होके क्या बनना है, my answer always was कि मुझे डॉक्टर बनना है. And that is the right intent. That is the first thing that you need to have to become a doctor. The second thing is the ability to make hard choices. लाइफ के हर पड़ाव में आपको हार्ड चॉइसेस करने होंगे, और ये हार्ड चॉइसेस सिर्फ आपके पेशेंट्स के ट्रीटमेंट के लिए नहीं, इट इज ऑल्सो इन योर पर्सनल लाइफ. जब आप एक स्टूडेंट होते हो तो यू हैव टू मेक द हार्ड चॉइस ऑफ सिटिंग इन द हॉस्टल एंड स्टडिंग फॉर दोज दिवाली वेकेशंस इंस्टेड ऑफ गोइंग होम एंड विजिटिंग योर पेरेंट्स. During your practice as a doctor, you'll have to sometimes sacrifice your personal time for your practice, for your OPD visits, and you cannot even see your parents who live in villages and whom you miss so dearly. So these are the hard choices you have to make. So now let's come back to my life. मेरे life के incident पे वापस आते हैं. Now I wanted to become a doctor. I've reached my second PUC exams, and in my second PUC exams, it was not like now when you have an integrated exams. We had to give separate exams for every entrance. So we had to give CET, we had to give AIPMT, we had to give IIT, AIEEE, JIPMER. We also have to give COMEDK, MAHE, SHEMA. So I had to give at least 10 exams during that time, and I opted to take PCMB. So both engineering and medical exams came together. Now, when the results came, I did not get a great rank in the IIT, AIEEE, AIPMT exams, and even in the CET medical exam, I did not end up getting a good medical seat. But in my CET engineering exam, because my PCM marks were good, I ended up getting a good engineering college, a top engineering college, and that to the computer science branch. So the situation was such that I had an engineering college in my hand, and there was only one exam result remaining. That was the COMEDK exam, which was the last exam that I gave. So I had to make this difficult choice whether to lock this engineering seat, which I had to lock within 1 week, or wait for the results of the COMEDK exam, which was coming 3 weeks later. So a definitive engineering seat, or go after my medical passion, which may or may not happen. So this was the difficult choice I had to make, and I don't have to tell you what I chose. So the gist here is that you have to make hard decisions in every phase of your life. So ये था second attribute. The third attribute is that of self-discovery. आप जब मेडिकल कॉलेज पहुंचोगे तो आप रियलाइज करोगे कि द बिगेस्ट नॉलेज यू विल गेट इन मेडिकल कॉलेज इज नॉट अबाउट एनी साइंस और ह्यूमन बॉडी, इट इज अबाउट योर सेल्फ. आप अपने बारे में सीखोगे, एंड यू विल गेट टू नो व्हाट योर स्ट्रेंथ्स आर, व्हाट योर वीकनेसेस, एंड यू विल बी टेस्टेड एट एवरी इंटरवल. सो यू हैव टू एनालाइज एंड गेट बेटर. Now I'll tell you my incident. I got into second PUC, I got my medical seat, और उस medical seat को पाने के बाद I had a lot of topper वाली vibe, and I had all of this ego in me and pride in me that I was somewhat of a topper. So I went into the college with all swing. I went into my medical college, and I realized that all the other 99 students with me were actually toppers from their own institute. So this was somewhat disheartening, but I did not lose my stride. Then came the anatomy exam. 2 months later, we had our first anatomy exam, and I did miserably in the exam. I remember doing very bad in the exam, and the marks were somewhat around 12 marks out of 100. So this broke my spirits. This made me decide or confused as to whether I've taken the right branch. I started questioning everything about myself and my decision. And at this point, I went back to the hostel, locked myself in a room, and started to analyze what my strengths were, what my weaknesses were, or kya galat ho raha hai. So I started thinking about what was going wrong. And after many such analysis, I realized that I'm not one of those students who can study the conventional way. I cannot take up a big textbook, sit and memorize it or remember it immediately. I required some help. I required help in a way that I understood diagrams better. I understood lists better. I understood all of these animations better, flowcharts better. So what I did was, instead of reading directly from a big textbook, I converted that knowledge into a simplified knowledge with a lot of images, with a lot of flowcharts, and I started studying it this way. I changed my method of learning, and this one simple change not only helped me pass my first year, it helped me pass all years of MBBS without any problem. Now, अगर कोई MBBS का बच्चा या MBBS आने वाला बच्चा मुझे सुन रहा है, तो you'll realize that if you passed all years of MBBS without any problem, that in itself is a big achievement. And not only this, this one self-discovery helped me become a better teacher as well. Now that I teach my NEET PG students, I use these same techniques of flowcharts, animations, and diagrams to teach my students as well. So this was about self-discovery. Now coming to the next and most important thing, that is to celebrate all your small victories. Now, as you become a doctor, it is very important to celebrate every small victory. अगर क्लास में अच्छे रैंक आया है तो सेलिब्रेट करो, अगर एक क्वेश्चन आंसर किया है तो सेलिब्रेट करो, वाइवा में अच्छा किया है तो सेलिब्रेट करो, इफ यू अर्नड अ स्किल, अगर कैथेटराइजेशन, आईवी कैनुला कुछ भी किया है तो सेलिब्रेट करो, बिकॉज एग्जाम्स आते जाएंगे. थ्रू आउट योर MBBS ईयर्स एग्जाम आते जाएंगे. मैं अभी 30 ईयर्स का हूँ, आई एम 30 ईयर्स ऑफ एज एंड आई एम स्टिल गिविंग एग्जाम. सो एग्जाम्स विल कीप कमिंग, बट यू हैव टू सेलिब्रेट. And don't wait to get set in MBBS, because your parents will tell you that after MBBS you're set. Then internship will come and they'll tell you after internship you'll become set. And then NEET PG exams will come, and after that your PG will come, and then your practice will happen, then super specialization, then marriage, then practice. So many things are going to happen. So you can never wait to celebrate. Celebrate every small victory. Now let's go back to my life. I'm in the internship, I finished my MBBS, I'm in medicine right now, and in medicine, suddenly a patient in the ICU crashes. Now, as the patient crashes, all the main doctors, along with us interns, go to attend that patient, and we start giving CPR. First, the consultant gives CPR, and then we start giving CPR, and I'm terrified because this is my first time giving CPR. But I anyways do it, and I do a good job, and we end up reviving that patient, and I remember that day like it was yesterday. I remember celebrating for almost a week at reviving that patient. And even now, after I've become a surgeon and done so many surgeries, if you ask me, tell me 3 of your best moments in medical, I will still include that ICU moment, because for that intern Daivik, reviving a 90-year-old lady with widely metastatic lung cancer was one of an achievements. It was one of the greatest moments in his life, and that is why you have to be able to celebrate every small victory if you want to survive this long medical journey. And then the last thing, the last attribute I want all of you to have is to have passion towards medicine. And I know what all of you are thinking. You're thinking that I've already told you that you have to love your branch, you have to have the right intent, and now I'm telling you, you should have passion. So isn't love and passion the same things? It's not. It's not the same thing. ये दोनों same चीज नहीं है. Love is something that will bring you to the field. Love आपको admiration के साथ आपको medical field में खींचता है. लेकिन passion वो पागलपन है जो आपको इस field में बनाए रखेगी. So it is important that you not only love MBBS, not only admire MBBS, but also develop a passion towards MBBS and medical if you want to get better. And I'll tell you my story. As an MBBS student, I was never inspired. I was never passionate about it. I did love medical. I did love MBBS and healing people, but I was never passionate about it. It was only during my NEET PG preparation time that I actually became passionate about being a doctor, about becoming a surgeon, and all of that. And the reason for that is the amazing NEET PG teachers that I've had. They opened me up to a new world, and that made me fascinated, and that fueled me to become passionate about medical. And with that passion, I ended up doing well in the NEET PG exam, and I ended up getting a decent rank, good enough to get me an orthopedic surgery seat. And not just this, 3 years later, when I was offered the opportunity to become a teacher myself, I took that opportunity up with the same vision that my journey of being an uninspired MBBS student can actually motivate me to become a better teacher who can drive this profession towards a place that is not only teaching students how to learn things, but also is accommodating of students' needs. And that is why I became a teacher. And in these 3 years that I've been teaching, now I'm working with a renowned platform called as Manipal Medays. And every time I teach, I have only one motive in mind, that somewhere in my class, there is a starry-eyed, confused kid like me, probably sitting somewhere in those last benches, whom I can inspire with my teaching. And that is the only hope that I have as a teacher. And this is my journey. ये है मेरी सच्चाई और इससे सीखे हुए कुछ लाइफ लेसन्स. एंड आई एम श्योर अभी बहुत लाइफ लेसन्स बाकी है, क्योंकि एज अ डॉक्टर यू आर ऑलवेज अ स्टूडेंट ऑफ मेडिसिन. द लास्ट एस्पेक्ट आईड लाइक टू आंसर इज अ क्वेश्चन दैट इज वेरी फ्रीक्वेंटली आस्क्ड टू मी बाय ऑल मेडिकल स्टूडेंट्स. इट इज कि ऑर्थोपेडिक सर्जन कितना कमाता है. So let's answer that question now. So normally after an orthopedic surgeon finishes his post-graduation, comes out of post-graduation, he ends up earning somewhere around 1 lakh in a college in the south, and in the north maybe 50,000 more. So about 1 to 1.5 lakhs is his normal earning in a medical college. But in private, he can end up earning much more. But the problem is every private college is looking for an orthopedic surgeon who already knows to do all kinds of surgeries. And as a freshly passed out surgeon, it is not possible for you to know all types of surgeries. So normally what does a student or a freshly passed out orthopedic surgeon do is he goes into fellowships, specializations. And during the specializations, the pay varies. And it is not as much as a doctor. You might end up getting somewhere around 20, 30,000 or 50,000. I know few of my colleagues who are even working for free because they're not looking to make money. They're looking to earn a skill through this job, because the main point in every surgical branch is to build your skill up. If you are a skillful surgeon, then any hospital is ready to pay you any amount. So during initial years of orthopedic surgery, you will be disappointed because your colleagues from medicine or radiology will be earning much more than you, and you will have somewhat of a learning curve. You may have to learn surgeries all the way up till even 35 years of age. But after that, sky is the limit, and you can make anywhere at the minimum of 3.5 to 4.5 lakhs. So this is about the average earning of an orthopedic surgeon. But if I have to summarize whatever I've talked till now into simple words, I'd like to summarize it into 2 quotes. The first one is by Elon Musk. He says that it is right for an ordinary person to choose to be extraordinary. It is right for an ordinary person to choose to lead an extraordinary life. And this is the gist of whatever I've tried to tell you till now, that I've had a very ordinary journey, but I've always been relentless, and I've always kept towards this path of leading an extraordinary life in medicine. So I want all of you also to take inspiration, or if not inspiration, just a reference from my journey. And the second quote is to all those students who always ask me, how is doctor life going to be? How is it going to be after I finish MBBS, after I finish my post-graduation? And to tell you that answer, I'll give you a quote by Art Williams. She says that I'm not telling you this journey is going to be easy. I'm not telling you that this journey is going to be easy, but what I'm telling you is at the end of the day, this journey is going to be worth it. Thank you everyone.
हेलो एस्पिरेंट्स, हम में से शायद बहुतों का सपना है नीट क्लियर करना, देश के टॉप गवर्नमेंट मेडिकल कॉलेज में एडमिशन पाना और एक डॉक्टर बनना. लेकिन एक प्रॉब्लम शायद हम सबकी जर्नी में आ रही है, और वो ये है कि जब भी हम कोई कोचिंग सिलेक्ट करने जाते हैं तो समझ ही नहीं आता कहाँ जाएं. हर कोचिंग क्लेम करती है कि वो बेस्ट है. हर कोचिंग ये दावा करती है कि सारे टॉपर्स उन्हीं के हैं. हर कोचिंग बोलती है कि उनके पास बेस्ट पढ़ाने की टेक्निक्स हैं, कि उनके टीचर्स का बेस्ट एक्सपीरियंस है. तो सच क्या है? आज के ओवर इन्फॉर्मेशन की दुनिया में सच ढूंढना मुश्किल हो गया है. जो ये कोचिंग्स नहीं समझती वो ये है कि कई बार हम एस्पिरेंट्स अपने माता पिता की लाइफ अर्निंग्स खर्च करके या फिर कई बार अपनी ज़मीन गिरवी रख कर कोचिंग में एडमिशन लेते हैं. हमारे लिए हमारी कोचिंग सिलेक्ट करना शायद हमारी लाइफ का अभी तक का सबसे बड़ा और महंगा डिसीजन है. हम इसको हल्के में नहीं ले सकते, क्योंकि ये प्रॉब्लम जोश टॉक्स की फैमिली के हजारों युवाओं को आती है. इसलिए जोश टॉक्स ने इस प्रॉब्लम को सॉल्व करने की अब जिम्मेदारी ली है. जोश टॉक्स ने कई टीचर्स, पास स्टूडेंट्स, टॉपर्स, पेरेंट्स, कोचिंग इंस्टीट्यूट ओनर्स और मेडिकल कॉलेज स्टूडेंट्स से बात करके ये पता लगाया कि जब भी हम एक कोचिंग से मिलने जाते हैं या कोचिंग को एडमिशन के लिए फ़ोन करते हैं तो हमें उनसे क्या क्वेश्चंस पूछने चाहिए ताकि हमें उस कोचिंग का सच पता चल सके। जब ये क्वेश्चंस जोश टॉक्स को पता लग गए तब इन फैक्टर्स के बेसिस पर जोश टॉक्स ने पता लगाया कि कौन सी कोचिंग में ये सब पॉइंट्स हैं और इसके आधार पर एक बेस्ट कोचिंग्स की लिस्ट बनाई। जोश टॉक्स को ये रिसर्च करते हुए अब 6 महीने हो चुके हैं और अभी तक जोश टॉक्स के हिसाब से देश की बेस्ट कोचिंग है आकाश। जोश टॉक्स ये रिसर्च कोचिंग्स पर कंटिन्यूसली कर रहा है और जल्द ही और भी कोचिंग्स इस लिस्ट में जुड़ेंगी। अगर हम आकाश में एडमिशन लेना एक्सप्लोर करना चाहते हैं तो डिस्क्रिप्शन में एक टेस्ट का लिंक है। ये टेस्ट हमें एक मौका देता है अप टू 90% स्कॉलरशिप पाने की। हाउएवर हम सबको ये जानने की ज़रूरत है कि ये स्कॉलरशिप वैलिड है सबके लिए और ना ही सिर्फ जोश टॉक्स की फैमिली के लिए। ये फैक्टर्स क्या हैं जिसके बेसिस पर जोश ने आकाश को सिलेक्ट किया है, नीचे डिस्क्रिप्शन में बताया गया है। अगर हम आकाश में एडमिशन ना भी लें तो भी जब भी हम किसी कोचिंग से मिलने जाएं तो हम उनसे ये क्वेश्चंस ज़रूर पूछें। जोश टॉक्स हमेशा एक बड़े भाई या एक बड़ी बहन की तरह हम सबके साथ खड़ा है। बेस्ट ऑफ लक टू ऑल द एस्पिरेंट्स। जय हिंद।